The Lotus Catheter is an FDA-approved, straight no-balloon catheter that is inserted into the urethra and retained in the bladder by gently pulling the bellows open, which activates the flower-like drainage lumen and makes a pathway for urine flow. To collapse the lumen and release from the bladder, simply push the bellows until fully compressed. The Lotus Catheter is safer and more effective than the current standard of care. Since the Foley catheter's introduction in the 1930s, the Foley catheter's balloon configuration has remained unchanged and is the current standard of care despite the Foley catheter's dysfunctional design, which causes infections and other complications regardless of improved clinical protocols and manufacturing materials. The Foley catheter is inserted into the urethra and the balloon is activated through a side channel by a sterile syringe containing an ampule of water. The Foley catheter can be accidentally activated inside the urethra or bladder neck, or the balloon can fail to properly deflate, causing serious complications and even death. The Foley catheter's lumen are located above the balloon, so residual urine is always present. Residual urine is the leading cause of the Foley catheter's high rate of infection, even with antiseptic coatings. Both residual urine and irritation contribute to the Foley catheter's associated urinary tract infections and bladder spasms. To remove the Foley catheter, an additional sterile syringe is required to extract the water and deflate the balloon. The Lotus catheter evolved from a desire to address the shortcomings of the Foley catheter by inventing an indwelling catheter without an inflatable balloon that minimizes infection and is also more comfortable for the patient. When the Lotus catheter is inserted into the bladder, the lumen rests at the bladder neck to ensure complete drainage, thereby decreasing incidence of infection. The Lotus catheter's soft drainage lumen resists inadvertent activation inside the urethra. The Lotus catheter's retaining drainage lumen are compressible for patient safety, and in the event of accidental dislodgement or misplacement, greatly minimize bladder and urethra trauma. In addition, the Lotus catheter's lightweight lumen design increases patient comfort as it rests on the trigone. The Lotus catheter's self-contained activating mechanism is easier to operate and decreases the volume of medical waste. Overall, the Lotus catheter is simpler, safer, and easier to use than the current standard of care.